like your tie-dye.
Thank
The
you,
tie-dye
thank
mask.
you.
But how are you feeling?
I feel good. I was a little nervous this morning.
Poor baby.
Oh,
Got
no.
foot.
So tell me, like, when your foot started hurting.
It started this crossing over about 7 or 8 years ago.
Okay.
And of course, I have trouble walking long distances, you know. It's just curving over more and more.
Okay.
It's just really bothers me. My shoes, they don't fit right. They hurt. Any closed-toed shoes hurt my feet. And then I have to wear open-toed shoes, and then it's ugly to look at, and I'm self-conscious about it.
Well, let's see how I can help you.
Okay.
Well, let's take these socks off, okay? Let's start with this one. I see bunions that have the overlapping toe, but I've never seen it where it was like the whole first toe was touching the third toe. That was pretty impressive. So this is the main culprit. How's it feel when I'm doing this? Anything? Or not so much?
No, it actually, when it starts hurting, I kind of have to work it like that to help with
Help it feel better.
Mhm.
Okay. I'm moving Lisa's big toe up and down, and it actually does have some great mobility, nothing that's crunchy or arthritic in there. When I'm pressing on this, what's that feel like?
That doesn't hurt. Where it hurts is on the bottom of that, right in there.
Right in there?
Right in there.
I hear you. What about the second toe?
The second toe only hurts when I wear closed-toed shoes, and it rubs on that,
Top area?
and it hurts bad.
You have what's called metatarsalgia, where the heads of the metatarsal bones are more plantar flexed than upright. Every step, you're putting more pressure right on the ball of your foot. So
Yeah.
we definitely want to fix it here and then address the cosmetic portion a little bit, okay? Because this bone should be sitting on top of this metatarsal bone, which is right here. Let me go ahead and describe to you what I believe needs to happen. We're gonna fix your bunion, which is your biggest issue with this. And then we align the joint and straighten out this toe joint.
Okay,
All right?
that sounds great.
I think it's gonna mess up her tattoo.
I could probably miss your tattoo. That's a nice one.
Thank you. That's my mom. Well, she's been gone for 14 years now.
And yeah, I'm gonna try my best, okay,
Okay.
to not ruin the tattoo.
Yeah,
All right.
don't not do the best you can do.
To save the tattoo,
I would rather
right?
you fix the
fix
foot than, yeah.
not save the tattoo. Got it.
Right.
And then the last thing we're gonna do is on this foot, we're gonna straighten out this toe here.
Great.
Just so you know, doing both feet at the same time is a little challenging because you don't really have
Yeah.
one side to lean on.
Right.
You know?
Yeah.
So, but you've got some help.
Yes, ma'am.
So we're all gonna help you work it out.
The hardest part for me is I am not used to asking for help, and I'm having to ask for help now.
Today is the day of Lisa's surgery.
Gonna take some nice, slow, deep breaths for me.
I'm doing both of Lisa's feet at one time. I start with the harder foot first, and then end with a simpler note instead of the other way around, you know? So I'm making my incision. Basically, I'm trying to get right down to the metatarsal. The plan for Lisa is basically to rotate that first metatarsal bone into a better straight position. This is the unstable joint that we're dealing with when we have a bunion. It needs to be rotated back into a more stable position. I put like a little joystick in the metatarsal bone, and I'll have my assistant kind of rotate it a little bit while I put the positioner in place. There we go. Until on the x-ray, I see that the big toe joint is straight and in place. The metatarsal's in a good position. And now we're gonna put in the cut guide so we can actually make the bone cut. Ready? Then we can fuse the joint in a more stable and aligned position that corrects for the bunion. Basically, I'm gonna slide the cut guide off, and then I'll be able to take off the areas that I cut. That looks pretty good. So the next thing is fixing the second toe. After the big toe was completed, the next thing was we had to address the second toe and straighten it out and put an implant in there to make the hammer toe straight. Push that down. So I was trying to put the implant into Lisa's second toe, and oh no, it fell. It fell. The implant just kind of fell off the instrumentation to put it in and fell onto the floor. It's on the floor. It sucks. It really does, because you can't pick it up from the floor and blow it off. You can't do that. It would be breaking all kinds of sterility. Oh God, what do we have? Basically, you have to have a brand new sterile implant to put in. And these little implants are not cheap. I hate that I dropped the small one. No, this is fine. Thankfully, we have a backup, and then, my butterfingers, started to work, and we got the implant in. That looks pretty great. Okay. Lisa's left foot took a long time, but the right one went pretty easily. We fixed her hammer toe, and overall, I think Lisa's surgery went really well. That left foot made a huge transformation. The second toe no longer overlaps the first toe. It has a very straight position, and same with the second toe on the right foot. Alrighty, so we're done, guys. Lisa was a very pleasant surprise in the fact that she didn't have many surprises. I guess the biggest surprise was, oh man, I dropped the implant. I'm good. Well, hello. Where's Lisa? How are you?
Oh, I'm doing good.
How do you feel?
I feel wonderful.
You're basically only 8 weeks out right now.
I tried to follow your orders,
So you didn't weight bear?
No,
at all.
Not until you told me to.
Excellent. I'm excited to take a look.
I know.
Okay. Both of her feet hurt. One foot was very bad and one foot was kind of bad. So we fixed them both, and I'm excited to see how she has been recovering. Looks good there.
It feels good. It doesn't hurt.
Good. This one's looking good too.
Yeah.
It doesn't cross over anymore.
I know. Yay. When I look down and I see that my toes aren't crossed anymore, I'm just like, yes. And there's no pain. And I can walk.
All right. So things are looking great.
I just feel like back to my normal self again. Lisa is back.